Okay. Yeah, what is this thing again? This is easy stuff. All right. Do you want to record me actually doing it?
I am. Yeah.
Okay.
Thank you.
Okay, guys, we're just gonna do it one more time.
So, chip 968000010745820.
Perfect.
Passport 968000010745820.
Check.
Check. Thank you.
All right, we're good. Thank you.
No, we're finished with the clippers. Okay.
Thank you.
You're welcome.
Can't see the tattoo. Yeah, the tattoo's hard to see.
It's faded, the last
It
number.
is faded, but I'm glad we have two.
3 of the numbers.
And I'm screen recording, so it'll be clear on my end since I'm not streaming right now.
Since we were accused, it might not be the same dog.
They said verbally there was confirmation though, and if you pause the video, you can read it. Okay.
Great. Thank you.
Yes, thank you all for letting us know.
Passport page.
Rob said HB, and Amber, we said the honey badger.
I was named that by my club. My lovely club members. They love me so much.
Honey badger don't care.
Right.
Honey badger, you Cobra.
Yeah.
Aww.
So for this video, we're just waiting for the vet to come in to listen to Qwenny's heart. We're just kind of hanging out.
She figured she just, you know.
And we're getting a video. Nancy's recording with her phone too, so. Not much I can do about it being blurry. I think Verizon would be good enough.
Yeah. Hello.
How you doing?
Hi.
How are you?
I'm Dr. Little. How are you?
Hi. I'm Gina.
Hi,
That's
Gina.
Nancy. Francesca.
Hi, nice to meet you.
Francesca, nice to meet you.
Nice to meet you.
Hi, buddy. What's up? I hear you got a little murmur, huh? What are you doing there, handsome fella? What's up?
Pretty girl.
Pretty girl?
Yeah.
Girl. Checking to make sure.
Making sure.
Does she have a litter?
No,
No.
we don't
When
think.
was her last heat cycle?
She just
She's
got
still
over
in
it.
it.
She
Okay.
just came out.
Okay, so that explains a little bit
Yeah.
of memory development. All right.
We don't believe she had a litter.
Oh, yeah, it's big
I
fault.
would hope not. I don't think she is.
Oh, see, mom's got treats.
Statement.
Thank you. Oh, what a good girl. Right. Well, she has a very loud, prominent murmur. I would call it a machinery murmur, which is very typical of what the PDA is. So it confirms what was already present in that report. Obviously, I can't confirm a PDA without an ultrasound showing exactly that, or having a cardiologist do it. But the patent ductus arteriosus, you guys know what that means, right? That PDA is supposed to close down. The duct is supposed to close down at birth, and it's just basically shunting the blood around the heart, so that because they're in the uterus, they don't need to pump the blood with their own heart. So as an embryo, that shunts it around so that the circulation, just the mom does all the work. Once they're born, that duct is supposed to close down so that their heart does all the work of pumping the blood, and that just hasn't happened. So surgically, I think you've seen the statistics. They showed in the cardiologist report what the expected lifespan is for a dog with a PDA that's been surgically corrected versus not. And I believe if they correct it, it's pretty much a normal lifespan. That's it.
Without it, she expires.
Without it, her heart is, I don't know how long they'll last, because I honestly have not, I would not be the right person to tell you, and I'd have to look at the statistics of how long they last without it. But I can't remember the last time I've seen one that we didn't surgically correct. So to be able to tell you how long they live with, without having the surgical correction, I wouldn't be the right one to answer that.
So you would say, what grade would you give it?
It's not a graded thing.
Okay.
It's kind of pretty much there or it's not there. It's a loud murmur. You can hear it everywhere. Every place I put my stethoscope, you can. Do you want to hear it? Have you heard it?
And I haven't.
I haven't either. I'd like to hear it too.
Yeah. So do you know what a normal heartbeat sounds? Boom, 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 boom.
Right.
Okay. So you're gonna put that in like that. And now just lean forward for me.
Wow.
I wish I had one of those electronic ones that transmits it.
Now you can hear it.
You want to hear it?
Oh, that's
Pretty.
You want to hear it? Okay.
She's gonna start ugly crying again.
Wow, don't cry. No, it's
okay. Look at
We get excited about this stuff because it's
it's science.
It's just so cool. And when if you think about how the dynamics work in utero and how they work afterwards, life is such an amazing thing that it all works and it all happens correctly.
Yeah, it's amazing.
And I have known regular veterinarians who have done the procedure. I don't. No, I've never done one. Would I love to do it? Absolutely, but it requires ventilators. It requires a little bit different level of anesthesia control. And as much as I egotistically would love to do a surgery like that, I'm not doing the dog any favors by doing a procedure when there are people around that can do it and do it well and do it fast.
Gotcha.
And so you have the options of U of I, Wisconsin, Purdue. So you've got 3 teaching hospitals within a 2-hour drive of here.
So suggest that.
So those are all options because those teaching hospitals are going to have surgeons there, and they may do it at a lesser cost as a teaching thing, maybe. So it's worth looking into. Or we take her to any of the surgeons in this area, VCA Aurora, VCA Downers Grove, MedVet downtown.
Somebody.
we were recommended MedVet, but I would like.
You know what, MedVet's great. I'm partial to the people in Downers Grove because I just feel it's like they take care of our clients a little bit better.
Okay.
That's to know.
And so, and VCA Aurora also wonderful, and the surgeons there I absolutely love. So I can print out. Did you already have your preferences?
Your choice.
Yeah, we'll talk about it. But can I ask you a really quick question? Is that murmur something that is easily missed for a veterinarian to listen to?
Oh, see, now you're trying to put me on the spot.
No, well, like, is it something that could have developed? Like,
so it was born.
It's not something that like all of a sudden she got it a month ago.
No, she's had this all.
Okay. So because it just didn't close in utero, so it's not like we didn't create it, we didn't train it into her.
Now, I'm basing my diagnosis off of a very prominent loud machinery murmur and a veterinary cardiologist report saying that's what he thinks it is. So,
And a second veterinarian said the same thing.
If it looks like a duck,
it
walks like a duck, that's probably not a zebra. So
I like that.
But it's not something we created or we made.
No, absolutely not.
Or caused.
No. I mean, it's just, and like I said, the dogs will grow. She might be a little bit smaller than normal because, but that may also be her genetics. But she does have a relatively decent body score. When I feel along her rib cage, I can feel those ribs without having to push in. Are they more prominent than they should be? Yes. But I could also say that about 90% of my German Shepherd patients because I can't put weight on any of them.
That's
so
not the case with us.
They're German Shepherds.
Right.
A lot of German Shepherds are afraid of their own shadow. They're very skittish. They don't eat very well because they're always worried that something's going to happen.
That's 99% of German Shepherds.
So this is not abnormal for me to see a German Shepherd that's not a body score of 5 out of 9. She's a body score of 4 out of 9. And so that's pretty common. So could the PDA also be connected to other vascular anomalies? Has anybody talked about that possibility?
No.
So there, when you see one genetic defect, there's always a possibility that you have others. And so, you know, we may have hepatic shunts or portovascular shunts that go around the liver. That's another thing that can happen. And I don't know the statistics of the PDA and other shunts in the liver, but that is something that, you know, doing a full workup prior to surgery, doing a full blood workup, making sure her bile acids are normal and there's no evidence of any hepatic shunts. You know, you'd want to do your homework before we proceed with surgery.
Wow.
Definitely.
Okay?
There's just a piece right there.
It's hard.
Is there any point in like getting an ultrasound or another ECG before going to the surgical center? Like, or would
Well, if you do that, I would want the cardiologist to do his own.
okay.
Because the person that's going to be doing the surgery will decide what their comfort level is
Okay.
and what they
That
want
makes
prior to
sense.
surgery.
Yeah,
So,
that makes
you know,
sense.
for them to have somebody else's report, it's nice, but they're always going to be happier with the person that they work with.
That's,
Okay, that makes sense.
That makes
Yeah.
sense, yeah. I really appreciate it.
Thank you.
Yeah, no
Thank you
problem.
so much.
She's a
Sorry
sweet
we
dog.
were late.
I
She's great
hope
dog.
that,
Yeah.
I hope that everything works out. As I told Maggie, I'm a little uncomfortable with the social